So first I'll introduce Cathy Smith, obviously one of our alums, and then she's gotten quite a few other degrees as well, so I'll have her tell you about that. Cathy is at Unity Point, and she's in the wound care, and she is also on our Alumni Association Advisory Committee. And so we appreciate her involvement in many ways. And then this is Erin Volz, and she is systems analyst, yes?
Sure, yes.
Yes, okay.
I think it
Also
makes
at Unity
sense.
Point, and one of our bachelor's degree alums. So Cathy started out with us as a diploma nurse, have I got that right?
Yep.
Yeah, and then Erin has been a health administration alum. So kind of fun to see the balance there between our 88% of nursing folks and then one of our bachelor's degree alumni, which is of course an area we want to grow. So anyway, what I've asked them to do is tell us first about their first job out of college, and then kind of give us just a little overview of the career path. And then after that, we'll open it up for questions. So this is Cathy, this is Erin, and I'm going to stop talking. Cathy, would you start us off?
Oh, I suppose I can. Let's see, graduated in 1976, yes, a long time ago, from Mercy School of Nursing. It was a diploma nursing program. At that time, there were a lot of diploma nursing programs. There are none now. That has been completely phased out. And so I had my diploma in nursing, and when first job was at Mercy Hospital. And the thing is, diploma nursing was hospital-based nursing, and so we staffed the hospital as students, and we learned on the job. I don't know if there's nursing students or who in this room, but now you learn, you have your classroom learning, and because that's the background, you need that in order to then work in the hospital. We learned on the job. And when my first job was neuro on, well actually it was Central 3, which is, that building's no longer there. And it was actually neuro then in the hospital, or plastics, burns. Mercy actually had a burn floor at one time. And so that's was my first job. I went back to school in 1988. And I went to Lamoni, Graceland College at that time. Now it's Graceland University. And the reason I went back to school is because my best friend, she was a BSN from Mount Mercy. And Audrey could tell me why I washed my hands the way I did. I didn't know why. I just got told by Sister Gervais that this is how I should wash my hands. Well, that's what I did. Audrey knew why. And so that made me interested. I need to go back to school. So I learned why I did what I did. And I got my bachelor's from Graceland in 1993. Yep, 93. At that time, when you went back for your bachelor's, none of my diploma nursing counted towards my bachelor's degree. And so what I did is what was it called, clept out or something like that? I took tests. I took a lot of tests. So I could get through American history, and I could get through algebra and all that stuff, so I didn't have to mess with that. I went through to DMAC for a lot of electives also, which was an excellent experience, and DMAC is a wonderful school. And then did correspondence with Graceland. And it wasn't computer, because we didn't have the whiteboard or the blackboard on the computer. This was 1988, before that kind of all came around. Now it's all computer. And so, you know, I would be on the phone with my chemistry professor in my kitchen with my son, Thanksgiving, doing a chemistry experiment with what was under my kitchen sink. And so that's what I did for 5 years, that kind of thing. It was a wonderful experience. And then, let's see, master's. Well, then, let's see, where did I work? Mike got transferred to Liberty. I worked in the emergency room at Liberty for 2 or 3 years, and I came back to Mercy because Mercy was the only place for me to work. Actually, it was the only place that had any jobs open at that time. And I worked in SICU at Mercy, and then a job came open at Mercy Home Care, and I worked as infusion coordinator, maternal child coordinator, and then a job came open at the hospital for a WOC nurse, wound ostomy continence nurse. And then because I had my bachelor's, then I could go and pursue that certificate. I also have a certificate in hospice and palliative care nursing too. And I've also had a certificate as an intravenous nurse, but I don't do that, infusion nurse, but I don't do that anymore. Then Mercy. So in 2003 or 5, something like that, there was a vice president at Mercy that was getting his doctorate at the University of Iowa. And he said, part of my dissertation, I want to do something with the non-traditional student. So Mercy opened, and the University of Iowa, they sent an email out to every bachelor's prepared nurse at Mercy and said, we'll pay for it if you give us 5 years of your life. And Mercy did. And so we were part of the Mercy cohort. There were 200 or 250 of us that applied, 25 of us were chosen, and we were part of the Mercy cohort. And 25 of us graduated with our master's in nursing from the University of Iowa. And that's how I got my bachelor's, and yes, I stayed at Mercy for more than 5 years after that. And then Tracy Juergensmeyer and I, Tracy's the nurse practitioner at Katzman Breast Center. We got together one day over lunch, and what are you doing? What am I doing? Oh, I don't know, let's go back to school. So we went back to school. And we said to the University of Iowa, you really want us. And they did. And so we said, we want to do this correspondence. They didn't do it correspondence, but we did it over the ICN. And so we spent a couple of days a semester at the University of Iowa. And then, so I got my nurse practitioner. Mercy didn't have a spot. Unity Point did. And after 35 years, even though I bleed Mercy Green, I am now at Unity Point. That's my story.
All right.
It's a journey.
I am Erin Volz. My story is not quite as exciting as that. I actually have worked on both sides of the health system, Mercy and Unity Point. So as a student here doing my HCA, I was actually a 100% online student and working full-time. I had a temporary position with House of Mercy as an administrative coordinator with them. They allowed me to do my 2 practicums that were required of the degree. So with those 2 practicums, I took the opportunity to work for Mercy HR under Carrie Boysen, was a senior HR business partner, and then also I worked with the clinic administrator at Unity Point Clinic, Urbandale, Family Med, Sports Med, and Physical Therapy. With those, I made a lot of relationships, got a lot of networking within the Mercy and the Unity Point health system. When I graduated, I was actually presented an opportunity outside of both health systems in private skilled nursing care. I was working as a human resource specialist for Hawkeye Care Centers of Iowa, which has since been bought out, traveling to all of the different skilled nursing facilities. They had about 12 within the state of Iowa, working with their regional HR and office managers, doing a lot of process improvement, building foundational work with a lot of the foundational things that I learned here. As a result of my practicum at Unity Point Clinic, I was able to meet Craig Flanagan, who was the previous CFO of Unity Point at home, and he had reached out to me through another channel and said, we have this position open as an executive assistant. We think you'd be really interested in a really good fit. We want you to come over to Unity Point. So I interviewed and supported their central resource team for about 2 years. So learned a lot about revenue cycle, business development, business improvement. Also dabbled a little bit into clinical compliance and specialty pharmacy and infusion services. As a result of that role and the success that I had there, I was presented with another opportunity to move up into corporate services within our accountable care innovation models, which I had actually applied originally for a job at Mercy right out of school, and they were restructuring that ACO and didn't have any positions available at that time. And so jumped on that opportunity, worked under great leadership there for about 1.5 years. Last April, we did a corporate restructure within that ACO, to better suit the innovation models that we're working with Medicare and our commercial insurance partners, and was promoted to network services specialist and financial analyst. So now I am working with all of our network providers across 3 states. With many different health systems. We partner with Mercy out of Cedar Rapids. We partner with the University of Iowa. We work with Genesis in Illinois, as well as the University of Wisconsin up in Madison. So have been doing that for now since September. It would have been 2014.
You're one of my students.
Yes, I was.
I can't remember all the dates.
It was very fast. I was able to complete this program, I think, within 3 years. So I know I did a very accelerated path. You know, the things that I learned here at Mercy, and especially with those core values, it really transfers to any position, any role that you go. And even in administration, the patient's at the center of everything. And that's really something that kind of came out of Mercy, working in HR. You know, you're really working with more people. You're hiring, you know, nurses, the people that are taking care of those. Now within that innovation space, you know, we still don't have the direct, patients are on the names of a list, but at the end of everything we do, it's going to be that patient-centered care is really the target and the focus of what we're doing.
Cathy, how about you?
Oh, Mercy?
You bleed green.
I do bleed green, still. It is patient-centered care, and that's the way it was in 1970-something, and it's the way it is today. Whether it's Mercy or Unity Point, it's the same way. It's patient. It's the patient. The patient is our customer. The patient is why we do what we do. It's so important, and I think those of us that graduated from Mercy, whether again it's 2014 or 1976, that's what we remember. That's what was most important at that time. What is this patient experiencing? What is this patient's journey? And I'm walking your journey with you for a short period of time.
So accountable care organizations, really our goal is to create value-based care and lower the cost of health care and increase care coordination. Within any particular region, system, we don't have every single specialty to care for every single patient. And so what the ACO does is network with those partners, whether they're employed by us or not, to create the best care coordination for that patient as well as lower that cost. With that, we also partner with different insurance companies. Our primary vendor is obviously Medicare. We work in an innovation model with them. So as we're taking better care of their patients, providing preventative services, you know, really looking at that patient from start of care, following them through chronic disease states, making sure that they're networking with the top quality providers that are providing the best service. And really working through that. So we partner with, you know, in certain regions we don't have specialists. In our Cedar Rapids region, there's really a shortage of primary care. So we've partnered with Mercy to make sure that we have enough primary care doctors to take care of the patients that are attributed to us in our contracts.
That's one thing that Erin says about preventative care. We try to prevent disease now, whereas back in earlier times, it was more catastrophic care, because Medicare in the beginning was catastrophic insurance. Yeah. Well, no, now we're taking care of the patient to prevent those catastrophic things that happen. The COPD, you don't die from COPD within 5 years now. You live with this disease. Cancer is, a chronic disease now. I have patients who are living with their cancer and they've been alive for 15, 20 years. I have one lady that's, been on her chemotherapy regimen for 15 years off and on. And they live with the disease. They live with cancer. They live with diabetes. And that's what we're supposed to do, is make quality of life better. And partnering with, Unity Point partners with Mercy. That's awesome that we do that, though.
Use your network and use your resources. Yeah. Take advantage of the practicums and don't be afraid to reach high. the worst thing somebody's going to tell you is no. So if you want to apply for a director job, apply. If they say, you're not qualified for it, they might have something else in mind. So reach for the stars and fall down trying.
And sometimes it takes a while. I was a late bloomer. That you can do it. Sometimes I look back and I wonder how I did it. But yeah, that you can do it. Erin and I were talking. Apparently, I know her husband, and we were talking. But I can, remember I was a Girl Scout leader, and I'm a Girl Scout leader, and I'm going to school at the same time, and my kids are in soccer or something, and I'm sitting at the top of a bleacher, doing a paper or reading something. But yeah, I'm looking up and watching my child too. But that's what you did. You sat at the kitchen table with your child, and you did homework, and Jake and Michaela did homework too. It's doable, but you also need a really good support system, whether it's Mercy College as your support system, which things have changed a lot. There is a really good support system here. And then, of course, your family support system, whether it's the husband or your mom or your dad or your sisters or her mother-in-law. Leanne was a wonderful support, but all those people, the community supported too. So it can be done.
Yeah, I would echo everything. You've just got to really stick with it. And, if you think there's not enough hours in a day and there's not enough time, yes, there is. It can really, you've got the people around you that are going to support you and get you through it. I was planning a wedding and caring for an ailing grandfather and had personal issues and working 2 jobs and you can do it. So a lot of the courses were centered around, it's going to be similar to a typical business management degree, but more healthcare focused. So instead of taking economics, you're going to take economics and healthcare. Instead of taking law and ethics, you're going to take law and ethics and healthcare. It really, to echo what I said before, it still centers around that patient. And while you're not getting that face-to-face interaction with a patient, particularly even in an online environment, you're still learning and you're still getting that. You can take what you've had as a medical assistant and you're still going to use that experience to be successful in it. I believe there are a couple courses that do require some in-person, and I think it's caring, is it not?
No.
I'm not sure if that was still a course or not, but requires some.
It's pretty much online now. Yeah, we did do caring. I don't know if you did that. I think you did micro thinking.
Maybe
Yeah.
There is a caring course as well that required some community service and community involvement. So still getting out and doing that was really easy. But even with the online environment, there's still interactions with other students. You can still come on campus if you need to, utilize the library, utilize your resources. There's open discussions that go on week that, yes, they are required, but you really get to know the people that you're working with in an online environment. And it's been a really long time since we did it, but I believe we went down and volunteered at the Salvation Army.
Okay.
And we toured a couple different volunteer opportunities. So there was several different ones that you could pick from. One was JAPA, which is assisting the homeless. There were a couple other ones, but that community involvement was something I've always done, and has always been a resource to me. And it was really good to actually get out and do that as part of school.
Graceland University focused on some community service. I spent some time looking under bridges for people to make sure that they were warm and safe. What else did I do? Can't remember the physician's name. But anyway, she was at-risk children, and I spent some time in that clinic. But mainly it was that kind of thing with Graceland. The University of Iowa, not so much, but yeah.
When I was here, it was right in the midst of when the Affordable Care Act was being enacted, renegotiated, changing. So the entire healthcare environment was changing, and having the resources here, teachers, students, people to bounce ideas off, look at what all of that innovation, what that change was going to mean when I came out of college. What is the change going to look like, and what does the future of healthcare look like? That forethought here at Mercy was so helpful that I was able to speak intelligently when I went out into the workforce about what was actually going on in healthcare.
They were here, they were Mercy.
Yeah.
So
That definitely was impactful, I would agree.
it was. The God aspect. You started each meeting, and I don't know if you all still do, but you started it with a prayer or with a reflection or something like that. That aspect of life at Mercy, and how important that part of it is, whether you're Catholic or non-Catholic. You were embraced, and still are. So yeah, that aspect. The nuns were, they were the head nurses on the floor when I started, and Sister Catherine haunted Central 3. Seriously, she did. But yeah, they just were there. Let's see, when was that building built? Oh goodness, that was an old building. That was the original hospital, but the dorm, let's see, in the wintertime, the radiators were so hot we had to open the windows. And there was no air conditioning. And we could sunbathe on the roof unless we got caught. And and the classrooms were in the basement, and then there were 3 floors. And freshman year, let's see, our curfew was 10, and but there was always a window open in the library that you could get into the dorm. And let's see what else. Yeah, it was a good thing that window was open. It was fun. It really was. But you lived it and you breathed it, and that's the way it was. Sophomore year or junior year, I don't know, it's 3 years, so you never know what you were. The second year, a friend of mine, we went to, I think it was Pat Mintel, because she was the head mistress. And, we are adults, and we should be able to come in at midnight, not 10. And so our curfew was lifted to midnight, and that was kind of a big deal. But yeah, it was a lot of fun, but you lived it and you breathed it, because, I would work 3 to 11 and get up the next morning and be in clinical at 7. And that's just the way it worked. And I was the nurse for 40 patients, me and a nurse's aide for 40 patients. And then Mrs. Evans was on the other side. And that's the way it was. But our patients weren't as acute. A lot of stuff is done at home now, and at that time, it wasn't done at home. Home care wasn't, VNS was there, but there wasn't home care. And so healthcare has changed tremendously. You've got sick people in that hospital, very sick people, and it's not what we had back then. A silly little student nurse could take care of 40 patients. I'm not sure it was safe, but we could do it. In fact, I know it wasn't safe, but that's beside the point. I learned a lot.
I actually really enjoy a lot of flexibility. I'm able to work from home at least 1 day a week, if not more than that, particularly with the weather being how it has been. Our ACO is a very small team. There's 13 of us. Our leadership, actually, one office is out of Fort Dodge, the other one's out of Quad Cities. So we have a lot of flexibility with being at home, being in the office, setting our own hours, really just taking that initiative and owning our work. It's done in an effective and timely manner. For fun, I actually was recently appointed to the Make-A-Wish Board of Directors, so I've gotten really involved in that over the past couple years. I've got to meet a lot of Wish kiddos, going to a lot of their events, so this weekend was a wine tasting.
Oh, my.
But really just getting involved in the community, and I fish. We have a lot of flexibility, so if I come in at 9 o'clock on a summer day, it's because I was probably out on the lake.
Oh, my goodness. I don't have that flexibility. I'm in clinic, and so clinic's from 8 to 4:30, and sometimes you don't always have the balance that you want, but I can also do my charting at home. I have a tendency to come into work about 5 or 5:30 in the morning, because then I can prepare for my day and I can finish up my charting and do things like that. My husband and I go to the Y almost every night. I love to walk. And so I'm walking the track during the wintertime because the weather's been really bad this year. But once that's said and done, we do camping. We camp at least once a month, and I take 3-day weekends and regroup. We like to hike. We live very close to Jester Park, and so we were up there last weekend and the weekend before. I got the car stuck at Jester. Oh, that was bad. But that's what we do. A lot of outdoor stuff. You like to fish, you know. Yeah. And then things at church too.
Yes and no. I've been accused of that a lot. My cell phone always has my email on it, because we're all spread out, and so just in the office and out of the office, we're all pretty receptive or responsive, sorry.
Yeah.
But there are times when it's time to shut it off. Dinner with my husband every night. Yes, I'm not going to be sitting and emailing, and I really try to. Part of our culture is that we value that work-life balance, and you need to be able to shut it off at the end of the day, or sometimes sooner. I mean, it just whatever needs to happen, and vacation was where I really struggled with because we have that flexibility to be at home, and it's on my cell phone that I can sit by the pool in Florida and look and read emails, so I don't have so much to do. But it can be done.
I don't have my email on my phone.
Good for you.
No. That's one thing I decided not to do.